Hi, I'm Shavonne, owner of Proclaim Communication and Rehabilitation Services. Welcome back to my channel. Now, you may be thinking to yourself, I'm too young to have a stroke, right? Maybe not. Strokes in young adults are relatively rare. However, over the past 2 decades, strokes in young adults has increased by 40%. Now, when I say young adults, I'm referring to individuals between the age of 18 and 65. This age group represents 10 to 15% of stroke victims, but every year, about 70,000 Americans under the age of 45 experience a stroke. There are 2 types of strokes: ischemic and hemorrhagic. An ischemic stroke is caused by an artery blocking clot that travels to the brain or forms within it. Hemorrhagic strokes, however, happen when a blood vessel in or near the brain ruptures. Some of the risk factors for strokes in younger adults are different, but many of them are the same, including smoking, diabetes, and high blood pressure. However, bad health habits aren't the only reason why young individuals are having strokes. For some women, being on birth control, especially while smoking, being pregnant or giving birth, can also increase the risk of stroke. Sickle cell disease, which is more prominent in the Black community, can be linked to ischemic strokes. There are other conditions that can bring about strokes in individuals under the age of 45. Some people are born with blood vessel malformations. Aneurysms can occur at any age, but a ruptured aneurysm is more likely to occur between the ages of 30 and 60. Most studies report that men are more likely to have strokes. However, women are more likely to experience greater disabilities or a higher rate of death after a stroke. You may have heard of the common signs of having a stroke, such as numbness or weakness on one side of the body, slurred speech, facial drooping. However, there are other signs to look out for too, including dizziness and confusion, double vision, nausea, and vomiting. So a lot of us have been taught think fast when it comes to a stroke, right? Well, I'm going to share with you a new version, be fast. B stands for a sudden change in balance. E is a sudden change in vision. F is for facial droop. A is sudden arm or leg weakness. S is for slurred speech. T is for time. Time is crucial. Call 911 immediately if you experience or see someone experiencing these symptoms. Resist the urge to drive yourself to the hospital. By calling 911, you let the first responders communicate with the hospital ahead of time. That way, they have ready the procedures and testing that they need to do to determine whether you have or have not had a stroke and to address it. So how does one prevent or at least reduce their risk of having a stroke? Seek ways to promote a healthier lifestyle for yourself. Consume more fruits and vegetables than high saturated fat and trans fat meals. Limit your cholesterol intake. Stop smoking and limit alcohol consumption. Some individuals with high blood pressure may need to limit their salt intake. And talk to your doctor. Make sure you're getting regular checkups. I'm going to get on a soapbox here. When looking for a provider, make sure you find a healthcare provider that understands you and sees you. Make sure when you leave that provider's office, you feel heard. Studies have shown that there are better healthcare outcomes when an individual feels that their healthcare provider, their doctor, understands where they're coming from, understands their life, and cares for them. Make sure you feel comfortable with the person taking care of your health. And make sure to take time out for yourself. I know hustle culture is very tempting, and we all want to make sure we're doing the most to provide for ourselves and our families. However, never place your ambitions before your health. I hope you found this information helpful, and I will leave additional resources in the description box below. Take care. See you next time.